Good morning, good afternoon, good evening. My name is Hyobum Jang, medical officer working on long-term care at Aging in Health Unit, WHO headquarters in Geneva, Switzerland. Thank you so much for inviting me to this roundtable series on mainstreaming knowledge on aging. It is my pleasure to participate in this specific topic on access to health and social care services for the vulnerabilities emerging from aging. We from WHO, as one of the leading agencies of UN Decade of Healthy Aging, would like to talk more about the health and care needs of older people for today's event. We all know that when people age, their health and care needs become chronic and complex. Unfortunately, we also know that our current health and care systems are not readily available or adequate to respond to older people's and families' diverse needs and multimorbidity. The current levels of unmet health and care needs among older people and their families are growing fast and concerning, and it is happening even faster in lower middle income countries. There are identified gaps to hinder the rights to health and access to health and social care services for older people. Let me start with some concern about growing demand for care and unmet needs. On average, more than 30% of people aged 65 or over live in private households or in need of long-term care, according to some data in the EU. Although the numbers and statistics vary between at least 10%, at most 50% of the people are estimated have at least one unmet care needs, even though they're having difficulties in their daily living. So there are many issues around health and care system which doesn't respond to these unmet care needs. The governance is not effective or efficient. Sometimes the governance are very complex, uncoordinated, and fragmented, especially between health and social care sectors and also between public and private sectors. The government should be more responsible and responsive, and they should lead and coordinate this care provision across multiple multisectoral entities and ministries. The financing is also one of the most common problems. Due to a wide perception that care for older people, ensuring their access to health and social care is too costly and will not be made sustainable in the future. The countries are not necessarily committing their budget to allocate to cover the access to health and social care for older people. So these service provisions are often underfunded by the public sector. We call for more universal coverage of health and social services for older people, also to ensure the informal care is more funded and supported by the government. The provision of health and social care services is not integrated, but is more fragmented and uncoordinated. There are many gaps in services and access and quality uneven. Services do not adequately address the needs of older people and carers, especially it doesn't really recognize or respect their preferences of value and their wish to age in place. So individual needs, including those of carers, should be regularly assessed and described in person-centered care plans, and that should be addressed with the integrated person-centered coordinated service provision across the continuum of care from prevention, promotion, to rehabilitation and palliative care. The personal dignity and right should be ensured in providing these care services. Often, information about health and social care of individuals are lacking or fragmented. A person's health and social care needs and their status should be identified, assessed, and should be coordinated between different sectors. Not only older people's, but also carers' needs should be identified, monitored, and supported. There's huge issues around informal care in every part of the world. So-called informal, unpaid, or family caregivers provide most of the care for older people, which is not really recognized or measured or supported. The workforce issues, especially on the informal carers, are hugely prominent in most of the countries. There are not enough formally trained or paid care workers to provide adequate health and social services to growing population of older people. And still, most care services depend on unpaid carers who are mostly women or family members or volunteers in communities without formal training, support, or recognition. As a result, those family unpaid informal carers are often overburdened, and this leads to their burnout and inadequate care, also resulting in their physical and mental distress. Those unpaid informal carers, as well as former and paid care workers, should be able to receive adequate training and receive support from the government's authorities, and their job conditions and decent working environment should be also ensured for adequate skilled workforce and service provision. How the countries can move forward this issue to provide the right to access health and social care services. One of the first steps would be to recognize all the people and their carers as one of the priority and focus policy target populations. It should be recognized and mainstreamed and legitimated in a standalone or as part of national level key policies or legislations. There should be also a dedicated and coordinated and responsible government body or focal point to be in charge in regulation, legislation, and also the implementation from national to subnational levels. Having more universal, comprehensive, and publicly led financing schemes and coverage schemes to ensure access to health and social care services without financial hardship is one of the key. There should be also comprehensive assessment of the needs of older people and their carers, which should be matched and followed by the adequate person-centered health and social services. The care workforce, including informal unpaid family care, should be able to receive adequate capacity building opportunities, job conditions, their career plans, and with also adequate support to address their own needs and stress. Although this is not easy to address at the same time, many countries are trying to solve these issues by their own legislation, national strategy, policies, or grassroots programs interacting with older people and carers. I urge all member states and UN agencies and relevant stakeholders partners to pay the attention and provide support to the WHO's effort and the frontline health and social care workers to provide adequate service for all the people and their carers. Thank you so much for your attention.